Okay, so let's work on chapter 11. If I'm having a myocardial infarction, I'm just having a heart attack. Fancy terminology for this. Angina pectoris, remember, is going to be crushing pain of the chest. This typically is going to happen to the males, not the females. We know that females are going to have the atypical signs of heart attacks: middle back pain, lower jaw pain, left arm pain. If I have asystole, remember that fancy looking line that we drew in class called the complex. If I have this normal complex, this was the PQRS. This is not asystole. Remember, asystole would be lack of heart contraction. Asystole is going to look like that big straight line. On Gray's Anatomy, you hear them call flat line. This is asystole. There is no heart contraction. Ventricle fibrillation is drawn like a big squiggly line. It is just going to mean that the heart is quivering. This is, or both of these things are going to result in no pulse, but only one of these that you can use for an AED. That is going to be a fibrillation is used for, or can be used with, a defibrillator. That's an important distinguishment between the two. Congestive heart failure, my body's inability to pump blood out. Therefore, if the blood can't go out, it's going to pool over into the lungs, which is what we call pulmonary edema. A cerebrovascular accident, cerebro telling you brain, vascular telling you vessel on the way to the brain. Cerebrovascular accident is a stroke. If I was suspecting somebody to have a stroke, I would have them smile. Remember, this will show asymmetry in the facial muscles. I would also have them hand hold way above their shoulders. This would show inability of them to be able to use gross body movement. Symptoms of a heart attack, like we talked about before. If I'm male, I should suspect I'm going to have crushing chest pains. If I'm female, middle back, left arm, lower jaw pain, faintness of breath. Those are all the signs and symptoms of a heart attack. I want my total cholesterol to be at least less than 200. Remember, my H, my happy, my good one, I want that one to have at least one of those for every of the lousy LDLs that I see in the body. Best case scenario, I have 2 H's for every L, 2-to-1 relationship between the H and the L's, but at a minimal level, 1-to-1. Your blood pressure, as we talked about numerous times, should be less than 120/80.